Hi! The conjunctiva is the thin, moist, transparent membrane that covers the white part of the eye and the inside of the eyelids. The conjunctiva is the outermost protective coating of the eyeball. The conjunctiva contains nerves and many small blood vessels. Acute conjunctivitis is the inflammation of the conjunctiva. It is usually caused by a bacterial or viral infection or by allergic reactions. Inflammation is usually bilateral and accompanied with a discharge. It can produce a sandy or gritty sensation in the eye. It may present with a discharge that causes the eyelashes to stick together upon awakening in the morning. There was probably recent contact with an individual who had conjunctivitis. The organism can be picked up from contaminated hands, fingers, or other points of contact that were contaminated, such as a shopping cart in a supermarket or a door handle. The conjunctiva of the eyes usually presents with engorged blood vessels that give the conjunctiva the inflamed appearance of a red or pink eye. Treatment will usually consist of an antibiotic eye drops, being used 4 times a day for 5 to 7 days. A physician may require you to use the drops more frequently the first couple of days if the infection is severe. The patient should limit contact with others for the first 24 hours after starting the drops. The infection will be less prone to spread to others after the first 24 hours of antibacterial drops are taken. If there is no resolution, the physician will need to investigate further. This may require that a swab of any persisting purulent discharge be taken for culture and evaluation under a microscope. Viral conjunctivitis. Most viral conjunctivitis is caused by adenoviruses or enteroviruses. It is commonly associated with upper respiratory tract infections. It usually has a 2 to 3 week course before resolution. It presents with a scant watery discharge. As mentioned in the last video, the preauricular nodes, those in front of the ears, may be engorged, enlarged, and tender. Diagnosis is usually clinical. Treatment is usually cool compresses and measures to prevent spread. The possibility of a secondary bacterial infection must always be watched for. Allergic conjunctivitis. This results from exposure to allergens and the conjunctiva reacting to these allergens. There may be a hay fever-like conjunctivitis related to pollen exposure. It is usually associated with a runny nose. Antihistamines may be helpful to reduce the symptoms. Contact hypersensitivity to common topical allergens may also be a cause of allergic conjunctivitis. Cosmetics, chemicals, soaps, and detergents may be the culprits. Stopping the use of the causative agent and the application of saline soap compresses may produce relief. Corticosteroid therapy may be needed if relief cannot be obtained. Corticosteroids should never be used on the eyes without the direction of a physician. Subconjunctival hemorrhage is another cause of a red eye. It occurs when blood vessels in the conjunctiva burst and bleed into the area under the conjunctiva. It can be caused by trauma or an increase in blood pressure. No therapy is usually needed. The blood usually resolves within 2 to 3 weeks. If it reoccurs, then further investigation is needed. There are other disorders which also present with a red and irritated eye, such as episcleritis. The episclera lies just beneath the conjunctiva. The episclera contains tiny blood vessels that supply nutrients to the sclera. Sometimes the episclera becomes inflamed. Scleritis. The sclera is the white outer layer of the eyeball. And uveitis. The uvea is the middle layer of the eye, which contains much of the eye's blood vessels. It contains the iris and ciliary body. These should require referral to an ophthalmologist. Well, I hope this helps. Have a good day.